What is the IGRA blood test for TB? Imagine a simple blood test that can tell if someone has been exposed to tuberculosis bacteria. That's what the IGRA blood test does. It stands for interferon gamma releases assay and is used to detect infection with the bacteria that cause tuberculosis. Instead of a skin prick like the traditional skin test, this test looks at how your immune system responds to specific TB proteins. It measures the releases of a substance called interferon gamma from white blood cells after they are exposed to TB antigens in a blood sample. Here's how it works. A small amount of blood is drawn from the person. The blood is then mixed with synthetic peptides that mimic parts of the TB bacteria, specifically proteins called ESAT6 and CFP10. These proteins are present in the bacteria that cause tuberculosis but are not found in the BCG vaccine or most other non-tuberculosis mycobacteria. If the person has been infected with TB bacteria, their immune cells recognize these proteins and respond by releasing interferon gamma. The test then measures how much interferon gamma is produced, which indicates whether the immune system has encountered TB bacteria before. There are two main types of IGRA tests. One is called quantiferon TB Gold Plus, which measures the concentration of interferon gamma in the blood within about 16 hours. The other is T-spot TB, which counts the number of immune cells releasing interferon gamma, usually processed within 8 to 32 hours. Both tests are highly specific for TB infection and are often used as screening tools. A positive IGRA result suggests that a person has been infected with TB bacteria at some point. However, it does not tell if the infection is active or if the bacteria are dormant, which is known as latent TB. A negative result makes active TB or latent infection less likely but does not completely rule out infection, especially in people with weakened immune systems or if tested too soon after exposure. Sometimes, the test may give an indeterminate or invalid result, which might requiring retesting. Clinically, the IGRA test is especially useful for screening people who have received the BCG vaccine, as it is less likely to produce false positives compared to the traditional tuberculin skin test. It is also helpful when skin tests are unreliable or when quick results are needed. However, it is important to remember that the IGRA is just one part of the diagnostic process. Healthcare providers will consider medical history, physical exams, chest X-rays, and microbiological tests to confirm if someone has active TB disease. It's also important to note the limitations. The IGRA cannot distinguish between latent TB infection and active disease. False negatives can happen, particularly in people with compromised immune systems, such as those with HIV. For accurate results, testing is generally recommended at least 6 to 8 weeks after potential exposure to TB bacteria. In summary, the IGRA blood test is a reliable and widely used tool for detecting TB infection. It offers a quick and specific way to screen for TB, especially in populations vaccinated with BCG or where skin testing may be less effective. Still, it should always be interpreted alongside other clinical information to guide appropriate treatment decisions. If you think you might be at risk or have concerns about tuberculosis, it's best to consult a healthcare professional for personalized advice and testing options.